There are many patients who get very worried when I tell them that we will place a stent in the ureter after the endoscopy. They don't understand what a ureteral stent is, what it can do, and whether we will leave it in permanently or remove it. I just wanted to make this video to explain to people what a stent is. Why do we place it? How long do we leave it in? Does it have any side effects or not? And what are the things that might happen while the stent is in place that shouldn't worry us if they occur? So what is a stent? A stent is a very thin tube. This tube has a silvery coil at the top and bottom. What does silvery coil mean? It means we can straighten it and insert it over the guide wire until we reach the kidney. Then, when we withdraw the guide wire, it coils inside the kidney and coiled below in the bladder, keeping itself fixed in this position until we remove it. So why do we place the stent? The main benefit of the stent is that it ensures the passage of urine from the kidney to the bladder. So when do we place it? Actually, after we perform the endoscopy, in order to reach the stone, we dilate the ureter so that we can insert the endoscope up to the stone and either remove it or break it with a laser. So after this procedure, we must place something to ensure the urine flows from the kidney to the bladder and to prevent the ureter from closing or something from blocking it after the operation. This is often done after ureteral or kidney stone surgeries. If we use the flexible endoscope, we place the stent, or if there is a narrowing in the ureter that we had to dilate, we also place the stent to prevent the narrowing from closing again. How long do we leave the stent in place? We leave the stent in depending on the reason for which we placed it. If the issue was a stone in the ureter and we went in, expanded and removed it, we leave it for 2 to 3 weeks. If there was a narrowing in the ureter and it requires a longer period for complete healing or full recovery of the dilation we performed, we might leave it for up to a month. The important thing is that we usually don't leave this stent for more than 3 months. Doctor, what are the things that can happen because of this stent? What should I be concerned about? In truth, there's nothing to worry about with the stent. However, there are some things that can happen with the stent. These things might happen or they might not. And if they do happen, we shouldn't worry too much. So what are the things that might happen with the stent? Firstly, this stent reaches down to the bladder. So with movement, it rubs against the bladder wall, which might cause a little blood to come out, slightly changing the color of the urine. The lining of the bladder wall from the inside is very thin, similar to the lining inside the mouth. So with friction, a drop or two of blood might come out in a water-filled sac, making the entire urine appear red. In fact, this increases when we increase our movement. The more we move, the more the friction increases, and thus the blood increases. So is this dangerous or could it cause us a problem? In fact, no, we shouldn't worry about it at all. This is a natural occurrence with the presence of the stent. So what else could happen? As we agreed, this stent is a connection between the kidney and the bladder. So when we go to the bathroom, the bladder contracts to release urine through the urethra. When the bladder contracts, the pressure inside the bladder increases. So part of the urine goes back into this stent because it is a tube, and part of the urine returns from the bladder to the kidney above. This creates a bit of back pressure or pressure on the kidney, causing some pain similar to renal colic due to the urine returning to the kidney. After a while, this urine goes back down through the stent and things settle, so we shouldn't worry. We shouldn't think that this is renal colic and that the stone hasn't been removed. Not at all. This is completely normal with the presence of the stent, and when we go to the bathroom, things return to normal. Also, the friction of the stent inside the bladder causes some irritation to the bladder wall. This makes us have a frequent urge to go to the bathroom even though the bladder isn't completely full, just has a small amount of urine. So we find ourselves wanting to go to the bathroom frequently to pass a small amount of urine. Some people interpret this as urinary retention, thinking they can't urinate. That's not the case. The issue is that the bladder feels full even though it contains a very small amount of urine. We provide treatment to reduce bladder contractions to alleviate these symptoms along with the stent. The truth is, as we agreed, these things might happen or they might not. Not everyone responds the same way to the stent. Additionally, the material from which the stent is made also matters. The stent makes a difference in the presence or absence of these symptoms. So how do we remove this stent? Actually, the stent has a thread at the bottom like this. Sometimes we leave this thread. If we expect that we will leave the stent for 2 or 3 days, not more than that, and this is in simple operations. This thread comes out of the urethra, and just by pulling it by hand, the stent is removed. But if we expect to leave this stent for more than a week, 2 weeks, or 3 months, we cut this thread so that the stent remains inside the bladder and we can retrieve it using forceps through an endoscope. In a very simple procedure that takes a minute, we enter with the endoscope, grab the stent and take it out, and that's it. So the removal of the stent is not really considered a major operation, but because it involves anesthesia and procedures, we consider it an operation. For example, can the stent affect sexual relations? The answer is no. Of course, the stent has nothing to do with erection. It has nothing to do with ejaculation. It has nothing to do with sexual desire. So just live your life completely normally. There is absolutely no problem with sexual relations with the presence of the stent. The second question, doctor, can I go to the gym? I go to the gym. I'm used to going to the gym. Is it okay to go to the gym with the stent in place? There's absolutely no problem with that. However, if we exert any effort with the stent in place, the urine might become redder, meaning the amount of blood in the urine will increase a bit, as we agreed, due to the friction present. So we should be aware that if we exert effort while having the stent, the urine will become a bit redder. We shouldn't worry. We shouldn't be afraid, and we should try to drink more water to prevent the excess blood in the urine from clotting and causing us problems. Okay, doctor, is there a problem if I leave the stent in? You mentioned that we would remove it after 2 weeks, but I'm traveling and will return in a month. Is there a problem if I leave it? There are no issues with leaving the stent in for a longer period than we agreed upon, but on the condition that we don't leave it for more than 3 months. Because when the stent is left inside the body for a long time, salts start to deposit on it, and it acts like small stones on the stent, making its removal a bit difficult. And this is something we actually see in some people who don't experience any symptoms at all after the stent. There are people who don't feel the stent at all after it's placed, and unfortunately, this makes them forget about it. We've seen cases where stents have been left for more than a year, and this can cause a very big problem because removing the stent at that point becomes very difficult. We need to go in alongside it and break all these stones with a laser so we can remove the stent without causing any issues in the ureter. If you decide to delay the removal of the stent, try not to delay it for more than 3 months to avoid this issue. Removing the stent should be an easy process without any problems. In the end, I just have this to say: don't worry everyone about the stent or the procedures involving ureteroscopes and kidney scopes, because these things have thankfully become, with the technology available now, they have become very easy, and it's easier than having a kidney colic. The scope and the stent have become easier than kidney colic. So don't worry about the stent. Don't worry about the scope. Peace be upon you. And if you have any stones, if you have any kidney colic, don't force yourself to endure the kidney colic, just to avoid the scope and the stent. Peace be upon you, and I'll see you in the next video, God willing. Peace be upon you.